Hello, everybody. Welcome and thank you so much for joining us at the Iowa Ideas Conference. This session is called Vaccine Acceptance. This session is part of the Diversity, Equity, and Inclusion track. I would also like to extend our thanks to our DEI track sponsor, Inclusive ICR, and we have a short video on Inclusive ICR.
Hi friends, Angelica Vanetta, co-chair of Inclusive ICR. We are a coalition of over 220 employers in Eastern Iowa, all working together to grow the diversity and inclusion of our workforce, to create a space where employees feel a sense of belonging, included, and valued. Inclusive ICR is a proud sponsor of the Diversity, Equity, and Inclusion track of the Iowa Ideas Conference. As you participate today, be sure to connect with other Inclusive ICR champions, as we'd love to share information with you about our upcoming coalition meetings, projects, and how our work is impacting positive social change in our region. Be sure to check out our website at inclusivicr.org for upcoming events and our e-newsletter. Thank you and have a great conference.
Thank you. My name is Sophia DeMartino. I will be the moderator for today's session. I am with Horizons of Family Service Alliance, that is a social services organization here in Cedar Rapids, Iowa. We are going to begin today's session by introducing our panelists and to our speakers. When you introduce yourself, please tell us about your organization and your role, and a little bit about how your work has been impacted by the coronavirus and the vaccine. We will get started with Daniel.
All right, good afternoon. Daniel Zinnel, I'm the CEO of Proteus. We're a multi-state nonprofit and also a federally qualified health center that provides services specifically to farm workers, so people working in the agricultural industry across Iowa, Nebraska, and Indiana. We have workforce training programs, education assistance, provide health and safety training to farm workers, and are also a healthcare provider where our healthcare delivery model is probably one of the most unique in the entire country. We have 3 brick and mortar clinics, one located in Des Moines, Iowa City, and Fort Dodge, but most of our healthcare is mobile, where we go to where farm workers are at and provide healthcare either on site where they're working, or we'll partner with a community-based organization or a church who will give us access to space so that we can provide great access to our clients and patients so that they can get the healthcare that they need and deserve. COVID definitely has thrown a huge wrench into our operations. One exciting thing that I think is a huge silver lining to COVID-19 is the ability for us to provide telehealth services. So before COVID-19, all federally qualified health centers could not provide it under our current malpractice insurance, but thankfully the federal government opened that up and now we're able to provide telehealth, which is a huge game changer for many of our patients who are in rural parts of the state. But early on, we saw how disproportionately impacted meat processing workers were by COVID-19. And so we wanted to do all we could proactively to work with our larger agriculture employers to set up mitigation strategies, follow-up care, and in the end created a very solid best practice that the CDC asked us to write up because we had such a successful model where we were testing migrants as they were arriving, working with employers to make sure that housing was appropriate, providing the necessary follow-up care, and in the end tested close to 3,000 farm workers, provided the necessary care, and in 2020 out of the 3,000 we tested, 0 died. So we call that a huge success. Unfortunate that is the measure for success, but we will take it. And then this last year, we've definitely pivoted to really focus and prioritize vaccines in addition to testing, especially recently in August and September when we saw the spike in Iowa happen. But now we're trying to get really back to basic primary care because our patients have been not necessarily focusing on the things that they need to focus on when they're diabetic or experiencing hypertension. And so now we're just getting back to the basics to make sure that our patients have the appropriate care that they need.
Thank you. Next, we have Mugisha Gloire.
So yes, my name is Mugisha Gloire, and I was born in the Democratic Republic of Congo. Jambo, natoka from Congo, nafurahi kuwa pamoja na nyie leo. So just me speaking right there, I'm speaking Swahili. Many of you probably have no clue what I just said. So born from the Congo, I've been in Cedar Rapids for 20 years. And during my last year of nursing school, I really started reflecting more on the community. I'm telling my instructors I want to be the 1% that makes a difference in someone's life. And started looking at the community. How come I'm not involved? How come I'm not engaged? So about 3 years ago, I started United We March Forward with the focus of helping immigrants and refugees pretty much assimilate into the community, helping them become self-sufficient as they become members of the community. So that was, I mean, that's the big goal, that families can feel that this is part of their community. They can contribute back. As we all know, immigrants and refugees, frontline workers, during the pandemic, and so many other areas. So how do we help them continue to move forward as well as they also contribute to our economy? So 3 years ago, started United March Forward. We were serving about 2019, we were serving about 40 families. Of course, pandemic hit 2020, barely a year in, but we from 40 families to 270 families by the end of 2020. And a lot of that because the need grew. There was a larger demand of services and different opportunities that families needed. So we're so grateful that we were able to be part of the ongoing support for families in the community. We focus a lot on resources, connecting families with resources, English education programs, and really the relationship building. As an immigrant myself, some of the families that we serve, I know them personally. I might be at their wedding, I might be at the kids' graduation. So for us, is building that relationship with families, because a lot of times you can build trust with families. You're better off to help them because they trust you. So, and that's what we do, really building the relationship and filling the gaps in our community as far as services and making sure that we're supporting the families. Pandemic has done a lot of things, as many, as many know. I think capacity building is one thing that we continue to look at. How do we continue to build capacity with our programming and strategic goals? Finding ways to communicate with families. And I think we were very strategic in ways on reaching families and supporting them. But the pandemic did do a toll on us as well. But it also provided opportunities. They say when there's struggles, it's a perfect area for opportunities and for a perfect area for growth. And I believe as an organization, we're able to meet that by figuring out the needs of the family, communicating to them directly, and then finding solutions.
Thank you. Next, we have Bonnie Lunsford.
Hi, my name's Bonnie. I'm a nurse that actually works at one of the hospitals in Cedar Rapids, and also do healthcare navigation for the Catherine McCully Center. Basically a fancy way to say that I'm a case manager for refugees and immigrants. If people don't know what Catherine McCully Center is, at some point I'll just drop a link in the chat box, but they have many different things they do. Specifically, what I'm involved with is the first 90 days that refugees and immigrants arrive in the United States, and helping with connecting them with healthcare organizations and medications and all the needs that they have in coming to a country that they know sometimes very little about. We have a pretty strong healthcare orientation and a cultural orientation that we provide for our refugees and immigrants. But I'm sure you can imagine that to accomplish something even as small as that in 90 days is almost nearly impossible, and that these individuals would be expected to retain that information and then also just move out and be independent in how they function in a different culture. So as all of us are so impacted by the pandemic, Our arrival numbers in 2019, we had as many, we were slotted to get about 180 refugees that we would help resettle. Ended up doing over 200 that year. And then of course in 2020, we really tailored back, and most of our work was towards the clients that we had arrived in previous years. And I think the number one struggle that we found was just trying to get accurate information out to the clients during that time, and trying to find creative ways to do that. Social media has been so helpful in doing that. There's an app called WhatsApp that many of the ethnic cultures in our country use to communicate, and found that that was a really great way to get them information as well. And then also did some similar work with vaccination dissemination, trying to get that information out to them that way.
Thank you, Bonnie.
Mhm.
Our final panelist is Dr. Yoga Shah, Chief Medical Officer at Broadlawns. Dr. Shah?
Yeah, thank you all. And Sophia, thank you for inviting me. I love to be part of this panel. A lot to learn from the three others, so thank you all. Yes, I'm a physician at Broadlawns. Broadlawns is our Polk County Public Hospital, and also geriatrician. And in that capacity, I used to work with my partner in the dementia clinic. And what Sophia, and we can talk during a discussion, but what I realized very early on in COVID and pandemic cycle is a couple of things. One was, which was very successful in Polk County, that we all hospitals, three major hospitals, Mercy One System, Unity Point System, Broadlawns, and Iowa Clinic and the VA, we all got together very early on, and March 7th, I remember that meeting. All CMOs got together saying, we need to work together, irrespective of what other differences we might have for how we do care for our patients. We have worked together, and that model is still working. We still talk to each other. I don't represent that group anymore. Dr. Nicole Gill represents Broadlawn. So that's one success story. The second, I would say, is a model which all of you probably use in some capacity. As a hospital where we have about 18% of our patients as a minority from a lot of different countries. We have 40 different languages represented here at Broadlawns. Realized that not everybody will be on the same page about COVID as we know now. And so because of that, also worked with a faith-based community with Corinthian Baptist Church here in Des Moines, in downtown Des Moines. And we had our first free COVID vaccine there, which became a pretty good state model, which was replicated at many places. I can share more about that, but thank you for this exciting topic.
Thank you all. So my first question is, can you please help us understand the history, or a little bit of history, of the COVID vaccine from the perspective of your work? What pieces of the past have impacted those that you serve in a positive or negative way related to vaccination?
If you want, Sophia, I can start, and then others. So why, since I, as a physician also, I have my MPH, a public health degree, and I used to be Dean of Global Health at Des Moines University, which is a medical school here in Des Moines in Iowa. And part of that topic was to travel around the world and talk about infectious conditions. So when in early January, late January, I heard about virus in China, we started work on this topic of possible, we all getting prepared for this. So what I realized very early on, talking to our own staff, that there was a lot of misinformation and mistrust not with COVID, with whether PPE or no PPE, with which ultimately mask or no mask. And then when the vaccine became available, unfortunately, the similar less trust in our system, the CDC answers continued. And I would intentionally create a small panel of staff working at Broadlawns from different cultures, different countries, India, Nepal, Congo, Uganda, many others, and learn from them. And then you mentioned, Bonnie, about WhatsApp, and they would say, Dr. Shah, we see it on WhatsApp that this possible vaccine is going to make me infertile, or pregnancy, I want to become pregnant, and then it's good. So that mistrust between the system that we learn early on to improve, which in healthcare, I feel the learning from this experience of pandemic would be, how do we appropriately pass medical information to the group which needs the most?
Other thoughts?
I guess I can go. So just me being an immigrant myself, I can pretty much say my survey is just speaking with families directly, going to my uncles, going to my aunts, and just talking to them. Yeah, what's going on? So in Africa, there's histories of vaccines being not understood. So, and I think, it plays also a part in some of the families that have seen how vaccines in Africa that were not maybe understood, and maybe side effects that happened back in their country. So there's those sort of history. And then there's also, I think, with the vaccine, it was very politicized. And I think that message also went to immigrants. And I think also more conspiracies. So as the doctor mentioned, it's a chip in someone's body, infertility. Just so many things. So many things I think were, sorry, my battery's low. So many things were just, so many messages were in the community, and a lot of families were fearful. And I think, when you have a culture barrier and a language barrier, and not being able to access proper information, I think made it just more difficulty, and for me, I try to look at it, because as a nurse as well, I try to look at it as a healthcare component, and also how can I reason, how can I logically explain? And I think what we did, we had professionals come in, share information with families. I got my COVID vaccine on February, so I shared the videos with families of me getting the vaccine. My wife got the vaccine, so we shared the story. Now, my wife and I were expecting, so we're sharing again the story, like, hey, we got vaccinated. My wife is pregnant, sort of, giving them that, that it's okay, but yet not forcing them, because I think, when we try to force people, we make it worse, and I think if we look at Iowa, the population of Iowa itself, it's about 3 million individuals in Iowa. And you look at the rate, 90% is white and about 4% Black. And so if we're looking at Black, we're talking about African-American, we're talking about Africans, anyone that would consider to be Black. And then if you look at the vaccine rate, 41% of white people are vaccinated, and about 17% of Black people are vaccinated. So for me, when I look at that, I guess what I'm trying to get at is, if we had a room of 100 people, that means 90 people are white, 10 people are people of color. So 40%, 40 people, white people, have been vaccinated, and maybe 2 people have been vaccinated. So the message is everyone needs to get vaccinated. So, making sure there's that narrative that, making sure, being an advocate too for families that, get vaccinated. Everyone needs to get vaccinated, because it's important. We got to keep people safe. We got to keep the children. We got to keep those who are elderly. So just having those conversations, as the gal mentioned, WhatsApp is a big tool, because that's how a lot of families communicate with their loved ones in Africa, because it's an internet platform where it just requires someone to have internet. So many families are on that platform. So utilizing WhatsApp, utilizing YouTube is another one, and just making sure families have informed, they have information so they can make informed decision. And I think what I've been so proud of and so happy about is, families have been reaching out lately saying, hey, I'm ready to get vaccinated. And I tell them, hey, I'm still alive. So, so just, again, I think it's building that trust, building that relationship, having those conversations with families. And I mean, it's okay if people are having different thoughts, but I think making sure that we're not forcefully pushing people away, so they can make a decision, because this pandemic has caused trauma in so many people in different ways, and we can't expect everyone to be quickly to jump on board.
I think, excuse me, Mugisha touched on something that I think is really critical with the people we serve as well, which is trust. And I think Proteus being around for over 40 years, we've fortunately been able to develop that trust with farm workers. And so early on, we started surveying our patients in January, February of this year, just to get a feel for how they were thinking about vaccines so that we could craft messaging and really work one-on-one with them going forward. After Johnson & Johnson was approved, we decided to prioritize that vaccine just because we have so many migrants that come to our state, and some of them are only here for a very limited time period. And not knowing if we would see them again before they left, we wanted to make sure that they had at least some protection. And so over the course of the summer, we really focused on Johnson & Johnson. But we captured some videos of patients talking about why they were getting vaccinated that we shared before large vaccine events, where patients who were in attendance could hear directly from people like them on why others who they work with are getting vaccinated to not only protect them, but their families. And so I think that was really crucial to getting people willing to get vaccinated. Shameless plug, but the Gazette published a piece I wrote, a guest column on something in response to something our governor shared about the cause of the rise of COVID-19 in Iowa, which she said was due to migrants and immigrants, which I respectively provided information and data on why she was wrong. What we found with migrants as they were coming to Iowa, a good number were already vaccinated, or they were lining up to get vaccinated by us. And so we were really proud of the farm workers who were wanting to get vaccinated, calling us, wanting the Johnson & Johnson. And so I wanted to make sure that Iowans heard from us who we see what's happening on the ground from our standpoint of what's going on specifically with farm workers. So we're now trying to figure out, I think there was something that came out today about Johnson & Johnson and potentially using Moderna in the future as kind of a booster going forward. So definitely things are changing day to day that we're constantly looking at on how we can best provide accurate information and necessary care for the patients that we are serving.
Thank you. So I've heard a little bit about some misconceptions that existed around the vaccine related to infertility. What is the current state of vaccination? Are you still having people who are coming to you and having questions about things that they've heard about the vaccine? Are people more willing to accept it now that it's been around for about 7 months?
I can address that actually. I spent some time today talking to some of my coworkers that work directly with women in the African community. And I would say that there's still a big hesitancy around the infertility piece. And maybe going forward, if we're going to focus on anything, it might need to hone in on some of those real specific ones that seem to make sense to them. And some of the women are scared of that. And even though they have friends that are getting pregnant, and Mugisha, I think that's wonderful that your wife is pregnant and that you can also share that with your community, because I think that is going to speak volumes about what the truth is and help provide that information for them. But yes, I still think there's some work to be done to continue to push that forward.
So Bonnie, I have a question, Sophia, for Bonnie. So when after so long now, so many pregnant women have taken, there are studies internationally, and it's been safe. So what will change mind of concerned people you're talking about? What would change? If I was to come in front of that group, what information are they looking at for?
Yeah. I think something that we've talked about here as well is having people from within the community that are also in healthcare being a part of that. So for instance, if you were able to actually come and spend some time individually with these women or as a group, and that it wasn't someone like me, but somebody that was of color that was from their own population, I think that would go a long way to help build that trust. I just think there's a lot underlying that issue and not just the specific vaccine issue. And Mugisha, maybe you have some thoughts on that too?
I definitely agree. I mean, with a lot of women, the infertility is a major concern. It's I mean, the good thing of what I can say, I had a few women reach out to me. I think two of them are working at Waterloo, the meat factory, Tyson. And Tyson is beginning a mandate for individuals to get vaccinated. So they had reached out to me and said, hey, what do we do? Which vaccine do you recommend? And I just shared, Moderna and Pfizer, they're both two doses. Johnson & Johnson is 1 dose. And immediately she said, well, I've heard Pfizer is better and Moderna. Well, and I told her, I think, they're good ones. And then she asked me, which one did you take? And I told her I took Pfizer. And she started asking, what are your symptoms? Or, just those questions. And I asked her, the person that's going to administer that will have more information. I can only share personally, what I've gone through. But yes, I recommend that, you should take it. And she would ask, so what happened afterwards? And I'll tell her, if my arm got a little sore, but the doctor said it's normal. And I think, I think with time, a lot of families, a lot of individuals, as long as we make sure that we're pushing that information, factual information, coordinating efforts that, proper information is going to families. If the doctor is willing to come, he should come in front of the audience and just speak with families. I know families that are wanting to go back to like Africa or different countries, and they're told that they need to get vaccinated. So they're also reaching out and saying, hey, is it okay? Is it safe? So I think some families, some individuals are getting up to it. I don't see it as a quick thing. I think it's a slow progress, but continue the conversation, continue those providing factual information and letting them make their own decision. As a healthcare provider, I think, the psychic part of it is also important. When someone is feeling like they're ready to do it, then they should do it. So this individual, I think she's gotten both of them. And last time I seen her, she was really excited. She was like, not excited, but she was like, what was I fearful of? So, she's gone over that curve now, and now she feels okay. But yeah.
I think that just goes to show the positive impact of policy change that we have seen with the number of individuals who were hesitant before, but with the vaccine mandates that we're seeing come up across the country with employers. Even though, yes, I think choice is always a great option, but when it comes to public health, things like policy change are critical to making sure that we're protecting everybody. And so just this last week, there's been a lot of data that's been released on the positive impact that policy changes happened in increasing vaccination rates.
So there have been many highly publicized opinions about vaccination from celebrities like Kyrie Irving, like Nicki Minaj. How do these high profile opinions impact local vaccine acceptance? And are they more, do they carry more weight than the opinions of your friends, your family, your own physician?
They shouldn't.
Are you hearing from people about, concerns that they have based on things that they've heard from their friends, their family, insight from their, our local champions?
I think friends, family, and even pastors were hearing. There's, I think, a lot of concerns I have from some of the things I've heard pastors say. And so I think making sure that all people in positions of authority and power have accurate information to share with the people that look up to them. And so I think it's really crucial for any person in position of power or authority to share accurate information and not spread misinformation or myths, which I think is why it's one of the things our providers always do is they talk personally about, I would not ask you to do something that I myself would not do. I myself am vaccinated, my partner's vaccinated. When my kids can get vaccinated, they will get vaccinated. So really making that personal connection with our patients is really key and critical because they do trust our providers so much. And so I think it is crucial for people in positions of power to use their position for good and not to spread misinformation.
Daniel, totally agree with you. Not now as a physician, but the reason we went at the Corinthian Baptist Church here in Des Moines, and luckily Dr. Reverend Pastor Whitfield agreed on being on media and take the shot in front of media, saying that here I am, I'm taking the shots of power. Yes, and not only that, he did brilliant. He invited 10 other pastors from not just Black churches, but Latino, Asian, and others. And they were all 5 at a time, 5 sitting in front of media. And that time, in a small room, Bonnie and Sophia, a very small clinic in basement of the church, there were people, the governor was there, Secretary Vilsack was there, Mayor of Des Moines, Mayor County were there, multiple leaders, and they took the shot. The only part of which he took a bigger risk, not just take the shot, but I gave him the shot. So that was only, I think, the risk he took, but it was worth it.
Mm-hmm. We actually had one of the respected community musicians within Lynn County that was kind of a spokesperson for us. We did some YouTube videos, and he had his vaccine here when we had our clinic, and I think that also was seen by the community as something pretty trustworthy. So yeah.
Now, Daniel, you talked a little bit about the importance of policy. Several, in fact, 12 state governors have signed legislation restricting mandates related to vaccination. How have the actions of Iowa policymakers and government leaders affected vaccine acceptance among the population? Maybe I'll edit that one. How have the actions or inactions of Iowa policymakers impacted vaccination acceptance?
I feel it affects any leader, as Daniel and as we were talking. If for me as an example, if I'm the chief medical officer at Broadlawns, and if I decide not to take it, then the 2-3 things can happen. One is I do not then have right to go out and tell my team, say, hey, take it. Why did you not take it? That's one. Second, even subtly, the message then can be, okay, if Dr. Shah has not taken it, he's the one who knows this topic very well. there must be something about the vaccine which he can't share publicly, but he doesn't want to risk himself. So it gives a message both ways. And if I'm the first one to take it and take it in front of the media and say, hey, here I am taking it. And as Mugisha, you mentioned, and then tell the people after 2 days, after 2 weeks, after 2 months, here I am, I'm healthy and I'm survived. So that also gives a positive, and it worked. In my case, my associate, my assistant was very hesitant. And then I took it. She waited almost a month after my second one and say, okay, I trust you, we work together, you've taken it, and now I'll take it. So it works by examples.
She just wanted to see you make it through both shots all the way.
Yeah, she said, yeah, you sound a little foggier than before, but that's normal. And then she
Can you tell us a little bit about how the urban and rural divide has impacted Iowa residents?
Yeah, Bonnie, I'll let you, or Daniel, I'll talk. I used to practice in a small town, so I can tell my experience, but anybody else?
So I grew up in rural Iowa, and growing up, vaccines were just part of life. I remember going to the co-op, which is where farmers take their grain in the fall during harvest, and county health was there giving flu shots. So to me, there's just been, I think, too much it's been too political lately, and why we're seeing discrepancies and hesitancy and that sort of thing, because historically rural Iowa was probably the largest proponent of vaccinations before COVID-19 in recent years. And so I would like to see more efforts really focused on farmers and rural Iowans. And I'm on an Iowa Immunizes Coalition. And one of the strategies we talked about is asking farmers, would you stop vaccinating your animals? No, right? Like, you are going to continue vaccinating your animals because that's what you need to do in order to make money. And so really connecting to things that they will relate to, I think, will be really key and critical. But it is unfortunate how politicized vaccines are currently.
Any other thoughts on rural versus urban? Okay.
Well, I guess for me, I just add a little bit onto that. Just same thing Daniel said. I think, urban politicized, more people talking. I think maybe rural, less people seeing, I don't know. I guess I have limited, knowledge as far as the rural community. But again, you just letting, having trusted individuals, as the doctor said, getting vaccinated, leading by example, and letting families know and community know that it's okay. Sometimes I go back and forth with the policy, not disagreeing with you, Daniel, because I'm a nurse and, a big advocate for the vaccine. It's just, I think, certain push that have been done are good. This thing has just gone out of control. That's all I can say. We had a panel discussion with families, and it was sort of free for all. And we would ask families, when you came to America, did you need to get vaccinated? All of them will say yes. When you go back to Africa, like right now, if you go back to a certain part of the country, you have to get certain vaccination. So when I go back to like Congo, I have to have like a yellow fever vaccine. So, and I would ask families, this is a vaccine that you need in order to be in that country. What's different between this one and that one? And I think it was going back to what you're saying with celebrities and just other people, that may not be agreeing with this, because we got to understand, it may be the adults that are disagreeing, but it could be the young children, that are picking up the information and sharing with their parents. So you really never know where that information is coming from. So celebrities could be, playing the factor, So again, I think it's just building that trust, building that that sense that, hey, it's okay. Getting folks who are known in the community to show others that it's okay, and not pushing too much, because I think what I've been hearing rumors that people feel like if there's a vaccine mandate everywhere, they may not work. So I don't know to what extent they will do that, but so you have those push back and forth push, and I think it's figuring out when is it okay, when is it not, when is it too much, when it's not too much, when it's less, when it's not less. Yeah.
And that's a really interesting consequence potentially to be faced with when we're also dealing with a labor shortage.
On the kind of along those lines too, like of being sensitive to what methods we should be using to motivate people for the vaccine. We have also heard from some of our clients that if the vaccine's good and it's what we need, then why are they given incentives to get the vaccine? I know some employers were offering financial incentives to get vaccinated, and in their minds, for some reason, I think that just confused them. And, just got to be sensitive to the messages that we're sending when we put information out.
What is the ideal state for vaccine acceptance in Iowa? Are we getting closer to where we want to be?
So I can share some numbers and see if that so in the past, when that question got asked to me, we would give a range anywhere between 60 to 75% of population to get the herd immunity. And this was very early on. That's the concept of the herd immunity, meaning that out of 100, if 70 have been vaccinated, then they are protecting themselves and they're also protecting others. So that way, even if I carry the virus in my system, I am not, even let's say Daniel, for example, is not part of this herd, is not been immunized. And if I meet Daniel very close to, and I sneeze on him, my virus would then not have enough potential to carry that same potency and that cause him the disease. So that was the concept of herd immunity. What has happened over the time is that people, and that's what happened in big countries like India and many African countries, that along with people getting the disease has increased, and that has caused some natural immunity. So that percentage has gone down in many countries, but here luckily in Iowa our numbers are getting there. So just I got these numbers today, and overall and I'll give you both Iowa and Polk County. So in Polk in Iowa, at least one dose based on 13th yesterday is 69.2%. So 69.2% of people, adults who should get, has received. And in Polk County, that is 72%. Of course, the numbers would vary according to the age. So if you take down 18 and younger, that would be lower number yet. So I think we are getting there. It would be nice to have more people get it, so the children will be protected, but it's getting there.
So at this point, we are 7 months in, and we're hearing a little bit about booster shots and the availability of booster shots for individuals who've taken certain types of the vaccine. Are you hearing from your clients that they are actively getting those booster shots at this point?
We haven't heard otherwise, but yes, we've had clients, patients reach out about boosters for sure.
We have some too as well.
Are you getting any questions about booster shots? Are people clear on whether or not they should be going to get one?
I think there's general confusion on that across the board for most or many Iowans. So I think the general questions and concerns are pretty comparable to the general questions and concerns we're seeing, or the confusion about which vaccine can you get the booster and how long do you have to wait and those sorts of things.
What challenges do you see moving forward as we progress through the pandemic that we did not know was going to take this long? No one wants to predict the future.
Oh no, I can say the pandemic. So tell me again, Sophia, what would be the
what challenges do you see moving forward?
So what challenges which we already seen, and in healthcare more, I'll divide into two parts. One is for the healthcare providers, the pandemic fatigue, the COVID fatigue we talk about, that's very palpable. Meaning, even though the number of hospital patient admissions in Iowa, in Des Moines, at Broadlawns have gone down, but that is also not just down, and they're healthier people. These people who now, today we have 6 patients in the hospital. That's much better than 10 days ago when we had 14, but these 6 patients are very sick. And I just talked to my ICU doctor, and out of these 6, 3 who are on ventilator will most likely not leave Broadlawns. So that is creating false media news that, hey, numbers are down. Yeah, but numbers are down, but people who are coming in are much more sicker. 90% of them have not been vaccinated. They are at a younger age, and they die. And then ICU nurses, after 22 months of this COVID deal, it's harder on them. Enough that, as you might have seen in the media, enough people are leaving healthcare to do non-healthcare related work. So that's a one, and I feel that change is not going to be just limited to pandemic. Post-pandemic, people will think twice to do some of the healthcare work, what we need to fulfill patients' care. So that's my big concern. And the second is this fatigue of pandemic fatigue and following the masks and others. That's affecting all, and I've been part of it. As soon as there was a small gathering, I was there. So not knowing out of this 100 people how many are vaccinated or not. So that's I feel that's going to impact and take us longer than what it can be or should be.
I also wonder if I'm sure there'll be long-term effects of people not wanting to go into healthcare careers. So, high school students or college students that are in the midst of wanting to pursue something that they're passionate about might think twice just because of seeing how hard it's been on individuals they know that are working in healthcare too.
Well, in Iowa, we're quickly approaching legislative session, and so I anticipate things are going to get even more politicized, unfortunately. Based on just today, I saw an article about Iowa legislators wanting to introduce a ban on vaccine mandates for private employers. So I think we can predict the future of knowing that it's going to be still politicized, potentially even more when legislative session is around.
So we do have a question from the audience. The question is there any concern about the possible confusion in explaining the plan for crossing different brands of booster shot to patients? They specify that they are citing a study released by the National Institute of Health this week about Johnson & Johnson vaccine as the initial vaccination, but then I think people are getting Moderna as their booster.
This can be a good question. It's a concern that people listening to it, but my suggestion would be the systems we know for, meaning currently at Broadlawns and all healthcare system will follow what final recommendation comes from CDC. There are a lot of countries, a lot of people are trying different combinations. So England did long time ago, Israel did it a while ago, that if I have received Pfizer as my 2 shots, then trying to get Moderna, hoping that even though both are mRNA technology, but hoping that there will be slight change and better defense system developed by my body. And even though that might be true, in US currently the way it is for now, yes, Johnson & Johnson is an exception. If I received Pfizer, then it's a Pfizer boost. If I received Moderna, it's a Moderna boost. Would it change in future? Is possible, but I would not worry about possible change. Just follow what you have been taken and take that as a booster.
Everybody
So hopefully the future of pandemic, one of your questions, Sophia, if it is becomes a regular boosters like influenza, then we don't worry. None of you would know when you get your influenza shot, hey, what for, we call it quadrivalent, what for combination of influenza viruses my vaccines are carrying. You don't worry, just take the shot, hoping that the CDC's calculations of what for influenza virus we should protect this year based on the recent study about from Hong Kong and other, and we physicians, our clinics, we give the shot. So similar thing will happen in future.
Which I think is a great plug for all of us to get our flu shots right now.
Very much, they are here. You're right. I got mine, but they are here, and to avoid any more problem and confusion, because we all worry. As soon as somebody's coughing next to you, say, hey, God, is this the carrier from COVID? And are you vaccinated? As flu season comes and more cases of influenza comes in the system, there'll be more worry. The other worry what I have is, and that's throughout the state and maybe throughout the country, the testing material is not as prevalently available, freely available as we hoped it would be. Meaning, if Bonnie comes to me and saying, hey, I'm coughing a little bit, can you test me? It's not as easily available. We do rapid testing, it's called antigen testing, but that being negative doesn't mean that Bonnie is not the carrier. So there are a lot of still concerns about managing this, especially during the flu season.
Dr. Shah, can I come to Des Moines and will you give me my flu shot?
I'll give you today. If you, as soon as this panel is over and you tell me what time, I'll call my pharmacist to give you.
Great. I'll be there in 2.5 hours.
I mean it. We have it, and it's a time to take it.
Yep.
Yeah, and we started giving out a couple of weeks ago.
That's a really good point. People do not consider, no one asks, well, what type of measles, mumps, rubella shot are you going to give me right now? And that's also a really good point that people are really concerned about, as soon as someone sneezes around them, do they have it? Have I now been exposed? Do I need to go get tested? I think it's one of my deepest fears because I have a 6-year-old, and if you have a 6-year-old, they tend to sneeze in your face. So, without children being able to be vaccinated at this point, sometimes that can feel like it's the biggest threat to your home and to your safety. Are you hearing concerns from anyone about the safety of shots for children?
What we're hearing is not a lot of families are very enthusiastic about it. Of course, that's different with our household, but it goes back to the booster. A lot of families are like, if you already got the vaccine, why get a booster? And it goes back to the education. And I think going back to your question, predicting the future, we don't know, whether it's gonna, as Daniel said, continue to be politicized. I think the trauma is still gonna be there. I think those that lost their job because of COVID, those that had to work during COVID. I know in the immigrant community, there are families that die from COVID. I think everyone is sort of right now, and I think we're creating history. I think we'll look back, and of course, on television it'll look different, as we all do when we watch TV. It's like, wow, that really happened. But right now we're going through it. And I think some are building that resilience that, must continue pushing forward. And I think we're going to get to a point where some people are going to say, well, I didn't get my vaccine, and I'm still here. And then we're going to have those groups that are still adamant that, they made the right decision. And we'll get to where, maybe majority of families in America have been vaccinated, and I think this trauma, this probably be new way of living. I don't know about you guys, I go into a store, I'm masking up and I'm looking at everyone doesn't have a mask. I'm like, okay, what am I doing? Or I go to different stores and everyone has a mask and I don't. I'm like, what's going on? Or I'm leaving the car and I'm like, I got to go back and get my mask. So there's some small trauma there that, I think will still linger on. As one mentioned, kid might sneeze and, everyone's looking for a mask, or scrutinizing eyes, looking at that individual. I think we get into the flu season. I think this is a time we're going to see a lot of sniffles, and, educators and other people in the community are going to be, walking on eggshells, ready to test, so I think it's going to take time. But in anything, in order to have resilience, I think we have to continue the mission, and that is build the relationship, trust, continue with the education, and remain consistent. Because, a lot of times the doubters are waiting for someone to just crack. So by remaining consistent, building that trust, I think, there's hope, there's hope. But so that's where, and a lot of time I'm put in a position where, I have people that want to get vaccinated and I have people that don't want to get vaccinated. And I have to be in between, because the families we serve, they're immigrants and refugees, but they all have their own mindset and beliefs. And as we all know, we can't change how someone believes, but we can be that person that they know, like, I can trust this person, I can depend on this person. And, with that, maybe there's change to those that need to change. But anyways, I try to wrap all that up in those questions.
Yeah, I think we've been hearing across the board that building trust and building those relationships is just crucial to making sure that people feel safe in getting the vaccine and protecting everyone. In our last couple of minutes, what can Iowans do to advocate or take action on this issue? If you are at a nonprofit, this is a great time to request some volunteers, some donations.
Well, shameless plug, we have an event coming up Friday, November 5th that you can attend for free. Obviously, would love any funds that you can donate. And one of the things that we're proud of over the last year, we've expanded our healthcare delivery model to focus on small meat processing facilities. So we're starting with 2 this first year in response to how COVID has impacted those workers, and hoping to create a successful model that we can take across Iowa in years to come. So would love any funds to help us launch this project and get it off the ground.
Sophia, I'd love to share the vaccine informational flyers and the videos that we have. They're in multiple different languages, just so that the group can have those. Am I able to use the chat, or?
Is it giving you the functionality to do that?
Nope, it says it's disabled.
Okay. I think if we can get those to Josh, he may be able to post it in the actual event itself, so that people can still see that later.
Great.
Sophia, what I would say is that it's still not late to take the COVID vaccine. So if you, hopefully not on this panel or the audience, but if you know people, just pass the message, it's not late. And the reason I say that is, I have seen and I worry a lot about long COVID syndromes, post-COVID syndrome, meaning that there are people who are going to come to us in clinics 6 months down the road, 2 years down the road with possible brain fog, possible dementia, possible heart damage, kidney damage, and they are going to be part of our system, unfortunately. I just talked to the same doctor I talked about ICU. There's a patient with hiccups, which are hard to treat, and that's related to COVID. And it's known that long COVID can cause hiccups, which are very difficult to treat. So message to the communities, please take the vaccine. Yes, you might still get some mild symptoms, but hopefully you'll not get long COVID, because long COVID is going to change your life. And when that happens, it's going to be too late.
All right, thank you.
I think our message, United We March Forward, we're a local nonprofit grassroots organization, 3 years in. And as an immigrant myself, I think, well, along with our board members, when families are supporting United We March Forward, they're supporting a family or individual become self-sufficient, and the goal is to have more people like me, immigrants, who can contribute back to our community, who can become nurses, who can become doctors, who can become entrepreneurs. That's the goal. That's why I'm here. We serve families, to make sure that they have that opportunity. So individuals can donate to us. You can reach us on Facebook. I'm more than happy to speak with individuals that want to learn more. We have English classes for those that want to tutor. We have new programming that we're launching soon, where individuals in the community can become mentors and coaches to immigrants in the community. Just different ways. As myself, as an immigrant, been looking at ways for volunteers to connect with families. So definitely welcome those conversations. And it's a community, and in community it's unity. So in whatever way, we can all work together and collaborate. For those that may have a business, definitely welcome those opportunities too. So, but thank you.
Thank you all so much for joining us for this session. Thank you to all of the panelists for giving us your expertise and your insights. I really appreciate all of you having been here. Have a wonderful rest of your day.
Thank you. Thank you. Thank you.